First off, I wanted to ask you about what you learned about cognitive behavioral therapy for menopause.
Yeah, I'm glad you're asking about this. This actually was so important at the Menopause Society that it was given an entire day of pre-course material just on CBT. So I have to say that I really enjoyed attending that. And, I'm not a mental health professional. So I wanted to learn more about CBT, how it's applied, and how it might be applied to my patient population as a practicing gynecologist. And what I really, really took away from it is CBT can be used for so many things. Of course, we spoke quite a bit about hot flashes and night sweats as where CBT could be a vehicle to help with that, but also sleep, also certain pain syndromes, also just so many anxiety conditions, and also sexual conditions, which really can be helped by CBT. And look, this is a non-invasive way of managing symptoms that have much more invasive treatments. So why not consider this, use it as an adjunctive management tool to some of the medications and other things that we have. I was particularly blown away by some of the virtual reality tools that they brought into some of the lectures to suggest how people might be able to access CBT when, it's not always readily available for people.
Were there any particular methods that stood out to you that would be easy for people to use?
Well, easy, no.
Yeah.
Interesting, yes. So I was, this is a little bit, off the topic, but I was truly moved by some videos that were shown of patients who have gastrointestinal related illness, chronic pain, who really are just unable to get relief from some of the standard treatments. They were hospitalized. They put on their Vision Pros, and I have nothing to do with Apple, but it was incredibly cool to watch them go down a journey involving CBT with visual aid from this Vision Pro. And it was heartwarming, heartbreaking, and these people really were getting better. So I'm hoping we see more of this coming down the pike. And we know that it can be used for things like hot flashes and night sweats as well.
Were there any surprises for you? Did anything go, oh, I didn't know about that this year?
Yeah, yeah. And I'm hoping you'll ask about testosterone therapy a little
Oh,
bit
yeah.
because
Oh, absolutely.
Yeah.
so the big surprise for me, and it should not have come as a surprise, but there was a fantastic lecture given about the voice and menopause and how the voice actually changes as a result of menopause and possibly age, but that testosterone therapy, which we do use off-label for women who are suffering with lower libido or sexual drive, that testosterone therapy might have a permanent effect on a woman's voice. And I have to say, I have a lot of patients who are very open to testosterone therapy for their sexual drive needs and complaints, especially if they're distressed by that. But when you talk about side effects like hair growth or acne, they can kind of, accept that and note that they are reversible if they're uncomfortable or if they occur. But deepening of the voice that is permanent is really something that really didn't dawn on me as something to counsel patients about who want to take testosterone. So that is now part of my conversation. And while I have not had any patients complain about this, what if I had a patient who's like an opera singer or something along that line where it really might make a very, very vast difference?
Before we even get to talk about petitions, could you specify when it comes to testosterone treatment and the voice, is that applied to creams, to pellets? What's your position on pellets?
Yeah, I would have to say it's applied to all of the above. So, the standard is to recommend testosterone in the traditionally FDA approved male formulations and maybe cut the dosage down by about a tenth, particularly with the formulation that I normally prescribe. But I have to tell you, this is cumbersome, it's messy, it's often not approved by insurance, and it's expensive. So we do need some, workarounds in order to help women get the testosterone that they may benefit from. So, I have normally relied upon reliable compounding pharmacies that I'm familiar with, where I know the pharmacists and I can speak to them and they have a good reputation and rapport, to formulate testosterone gels for my patients. And I typically will recommend them topically. I always check levels beforehand of testosterone, and then I follow them usually 3 and 6 months later to see how we're doing and how people are responding from a clinical standpoint. I do not provide pellets. I have to say that they are frowned upon by the Menopause Society, and they do scare me a little bit just as a physician and as an individual person, only because once they're in, they can't get out. And you really do have to wait for them to, resorb on their own. And I just think that the dosing could be excessive because, everybody's individual. So providing pellets for one person may have a different type of dosage response than in another. I will also say that the practice I'm in doesn't allow things like this. So, maybe they're saving me from myself. I do not know. Either way, pellets are not my thing, so I'm not really an expert to comment on that. As far as oral testosterone, so I'm around long enough to remember an amazing product that was called Estrotest. And this was a combination oral pill of estradiol and testosterone, methyltestosterone, that was FDA approved for women. Don't really know why it went off the market, but it is unavailable. And so now we really rely on creams or the FDA equivalent for men.
Another thing that I had read about when I was looking at your blog is that, Veoza is now is now FDA approved and can be sold for women as a non-hormonal option for hot flashes. And Esilonitol should be out soon. But I didn't realize that they had changed the Veoza recommendations because of liver studies. Can you talk about the liver studies?
Yeah, absolutely. So I was not involved in any of those studies, but obviously as a practicing physician and chief medical officer at Bonafide, it was my responsibility to learn about this. And I thought it was another really loud message that we got at that meeting. So bottom line, after lengthy post-marketing survey, which is standard for all drugs, they go through their studies, they get FDA approved, and then the FDA still watches them and watches for adverse events over time. And I think this was a 52-week time span. And there were more concerns about hepatotoxicity or troubles with liver enzymes elevating as a result of this medication than originally anticipated. So the FDA has changed the prescribing labeling of Veoza or fezolinetant so that instead of what was originally recommended, which meant we should check liver enzymes before starting this medication at month 3, month 6, and month 9 after use, just to make sure there were no bumps of concern. But they've now changed their recommendation that this liver function testing should be checked baseline, meaning before starting medicine, month 1, month 2, month 3, month 6, and month 9. Again, with the thought to either discontinue or monitor with more surveillance if these levels are going up. The liver is really responsible for metabolizing everything, and loads and loads of medications. So if the liver functions are altered, not only can somebody become sick or have signs of liver difficulty like jaundice, like change in urine and stool color, but other medications can be affected in terms of their metabolism. So this is very important, and it's good that we know to do this. The reason I brought that up is because a lot of patients won't necessarily want to be compliant with having to come in for blood testing that often. And it is on our watch that we have to remind people to come and do these things out of safety, because after all, above all, do no harm. This is what we agreed to as physicians. So, I thought it was a news flash worthy of sharing.
Right. I was going to say just liver issues there's also with the hormones as well. Doesn't
Yes.
that, because I've had liver issues and I am on hormone replacement.
Yeah.
And actually, I go in, they want me to go in all the time. And I stopped supplements and things went down. Just, they had nothing to do with my hormones. This last visit, my liver enzymes were elevated again.
Yeah.
Can that be just, I'm curious, could that be related to her HRT?
Well, this brings up such a good point. So look, what could it be related to? I mean, it could be a medical condition, and I'm just speaking very broadly.
I know. Yeah.
It could be Tylenol use, which is metabolized through the liver, and this is why we have very specific dosing for that. Alcohol use, other medications, hormone usage, yes. But this is why there is such a change in the administration of hormones now to be transdermal, so that we can really avoid and prescribe more safely and with more, conservativeness, if you will, estrogen through a patch or through a cream or through a gel. I tend to prefer a patch, and I think most of my colleagues do as well, because this bypasses what we call the first pass effect through the liver, meaning when medication has to go, through your mouth and through your digestive tract, it gets metabolized by the liver before it gets into your bloodstream. But when you apply it transdermally, usually through a patch, it goes straight into the bloodstream and avoids the liver. So enzymes would be, considered sort of protected, if you will.
Right. And I do have a patch. That's what I wear. And I had a telehealth visit with my doctor on Friday, and she had started me on a statin.
Yeah.
And then she said, let's stop that for a little bit.
Yes.
I told her I thought it was alcohol. I did. I said, we'll go out to dinner. I'll have some wine. I don't drink every night. But she was being very generous, I think. But
Sure.
I always tell Colleen, my corpse is going to have this patch on me. I'm like, she said, well,
yes.
you check the hormones. And I was like,
and you are not alone.
No.
I mean, I have patients who, once they start hormone therapy, they feel so good and so much more improved. They would truly just say, I'm never going to stop this. And of course, we're going to revisit that every 6 to 12 months, but I hear you. I will say, though, as Chief Medical Officer at Bonafide, one of the other reasons that we were very interested in learning about this is because the mechanism of action of the medication fezolinetant and the other elazinetant that you mentioned is so novel and so interesting that the R&D department, and we have a big R&D team that is so super stellar at Bonafide, they were so interested in that mechanism of action where medication works through different receptors than hormone receptors in the brain, that they literally since 2021 have been researching ingredients that are nature derived, if you will, that can work through a similar pathway. So we are grateful to these pharma companies who have not only found these types of pathways, but have educated the public on them, because we really found that we could formulate a supplement that could work in a similar fashion and hopefully provide relief to menopausal patients who are suffering with hot flashes and night sweats, but who don't want to take hormone therapy, or who cannot take hormone therapy, or after hearing about this liver function requirement, maybe want to consider something else.
Since it is a supplement and we're talking about liver issues, is there any concern with the supplement going through your liver?
Well, we were very concerned about it. And that's why during our clinical trials with people, so we've done trials in test tubes to make sure that the science we think is working is actually working. And then we did trials in what we call preclinical studies, which relies on the animal model, so specifically in mice. And we saw excellent results, and we saw safety in those studies. So as we checked the mice's liver functions and we checked their hormone levels. And once we have really good results from that are reassuring, with safety and efficacy reassuring, we look at clinical trials in people, and we took the attention to check liver function testing in our participants because we had concerns about that. And they were fine, thank goodness.
Good.
So we really feel very comfortable that this is a safe and effective supplement for this purpose. That is not a drug, and it is not a hormone. I think it's also important that we didn't see any other adverse effects that were different than the placebo group in our latest 2 clinical trials. So again, confidence. And we at Bonafide, we really rely heavily on this type of sciences. We don't want to just be a random, snake oil type of supplement type of company. We are heavily research heavy.